Catalano. I'm the director of the residential master's programs here in the Department of Health Management Policy at the University of Michigan in the School of Public Health. I'd also like to ask my Associate Program Director, Charlita Daniels, to introduce herself as she is the heart and soul of our programs here.
Good afternoon. Thank you for joining us. And I work with the admissions process and actually throughout the process of you being a student and graduation. So I look forward to answering your questions in the chat if you have them and seeing your applications in a few weeks.
Great. Thank you, Charlita. So you can post questions in the chat, as Charlita just mentioned, or you can hold questions for a few minutes of questions and answers at the end of the presentation today. But what I'm going to do is just start us off by talking about the program and about what we're all about. So first and foremost, understand that health management policy is one department within a very large school of public health. And so if you were to look at the entire School of Public Health, we have other departments, including epidemiology, biostatistics, health behavior, and health equity. We also have an undergraduate program in public health, and we have a core program in public health that our MPH students take. So it is actually a rather large school community. But what we do is we focus on creating a very small community within the Department of Health Management and Policy. So what are the benefits of joining health management and policy? Well, there are many. First, we are not just a local or a regional community, we are a global community. And we're made up of learners and scholars. That is first and foremost who and what we are. We're lifelong learners. The students in the program are lifelong learners, and we consider everyone to be a scholar. And we work hard to understand what is happening in the world and how we can play a part in solving the world's public health problems and healthcare delivery problems. You would also be joining a group of healthcare and public health leaders. We're not just people who are interested in learning about things, we're actually interested in solving problems. And so you will find the University of Michigan alumni from this program in every corner of the world. And we are the boots on the ground that are solving the real problems of today. A lot of people who study in the Masters of Health Services Administration program are very senior healthcare executives who are very involved in obviously managing the day-to-day delivery of healthcare services to people in need, and we focus quite a bit on improving access to care for those underserved communities that need access. We also have a very robust group of public health experts, and nobody leaves here without understanding the roots of public health and why we do what we do. And the people who are researchers and scholars and students in the program get very involved in looking at both regional, local, and not both, but we look at regional, local, and national and global public health issues. And then lastly, what's really wonderful about our community is that when you come here, you become part of a community of colleagues. And many people who leave the program have developed over the course of their time here a group of lifelong colleagues, not just fellow students, but also colleagues within the alumni community. And then as you go out and you are the alumni out in the communities, you too will continue to form relationships with existing students in the program and you have the extended alumni network that is unparalleled in higher education. This is what we're all about. This is our mission statement. We use evidence-based data to improve the lives of other people. And we do that by focusing on how healthcare is delivered in real-world settings, but also, again, in solving the bigger public health issues. And so we do this in a very structured way, and you will learn about how to use evidence and how to use the skills that you would learn in the program to make substantial change in the world. Now, underlying any good mission statement are values, and these are our values: integrity, lifelong learning, as I already mentioned. We are a very collaborative community. We are not a competitive environment. Many other programs are highly competitive. We are not. Our students work together. They work with faculty. They work with alumni. They work with people within other parts of the university to collaborate and find solutions to very complex problems. We always strive for excellence in everything that we do. We are an extremely inclusive community. You will see that played out every single day in the classroom, in meeting rooms, and in team environments, in everything that you do. We are an incredibly inclusive, very small, tight-knit community within health management and policy. And we strive for equity in everything we do. When we're talking on a global scale, on big public health issue scale, we're talking about equitable access to healthcare services. And that translates down to care delivery and managing care delivery, ensuring that equity is infused in everything that we do in our public health and healthcare administration practice. I'd like you to meet the other members of the Health Residential Masters team. You've just met Charlita Daniels. As I said, she is kind of the heart and soul of the program. Whenever I don't know something, I go to Charlita and ask her. She always knows the answer. And so Charlita is a very important person in our program. Jacob Henningberg is another instrumental individual on the team. Jacob becomes your best friend when you are looking for internships. Everybody is required to do an internship, and everyone does an internship. And Jacob he handles all things related to internships and also assists you in your search for a fellowship if you decide to pursue a fellowship later on. Professor Kalali she is someone who you will get to know extremely well in your first year in the program if you join us here at Michigan. Professor Kalali teaches a course in professional development and teaches you all those skills that you will need as you will be exiting Michigan and entering the workforce, whether those skills relate to your job search, your fellowship search, or the little skills related to networking and how to eat properly at a business luncheon or a business dinner. Professor Kalali covers all of that in her professional development class. And then you've already met me. I'm the director of the program, and so I'm always a resource for anybody who needs me. And the same with all of us, especially Charlita and me. We are the two people who you can always come to with any questions. So I wanted to talk a little bit about the two primary programs that we run here. These are both residential programs. The first is the Masters of Health Services Administration. This is a 2-year program involving 60 credits, total credits of course time. It is a competency-based curriculum. What does that even mean? Well, it means that our curriculum is based on the competencies or the skills and the expertise that you're going to need when you enter the workforce. So we pay very close attention to what's going on out in the workforce. We listen to experts in the field, people who have extensive experience and who are in positions of significant authority in the healthcare administrative field. And we embed those competencies that health systems, hospitals, and other healthcare delivery organizations are looking for in new hires. Health Services Leadership degree program is focused on organization of healthcare institutions, the financial management and leadership of such institutions, marketing healthcare services, leading organizations that deliver healthcare services, and of course, the day-to-day management of those services. I mentioned earlier, everyone does an internship. It is between 10 and 12 weeks, meaning that you're doing that as a full-time internship during the summer between your first and your second years in the program. Everyone gets placed in an internship, or they get hired into an internship. These are paid positions, so you're not going to be working for free. And we place interns around the country. There's a significant concentration in the Midwest, but we have people doing internships across the United States, and we've even had people do international internships when desired. We have a host of student clubs and organizations that you can get involved in. If there's an interest, there's a club for that. And so we encourage people who enter the program to get very involved. One of the things I love the most is when I walk around and see students in the student lounges or in meeting rooms, meeting as clubs in organizations, working on projects together. It's really the benefit that you get of being part of a full-time residential program. You have access to joining a number of different professional organizations. One of the most popular for MHSA students is the American College of Healthcare Executives, which is the gold standard professional organization for future healthcare executives and current healthcare executives. We have a number of case competitions that we participate in on an annual basis. We fund the teams to go to these case competitions, and you are essentially going to solve real world problems for usually large health systems or hospitals. And these are competitive environments, and there are usually monetary awards associated with placing in these kinds of competitions. It's also a great opportunity to network with other students and senior professionals in the industry and get to know people and begin building your professional networks. And then some students go on to do postgraduate fellowships where you commit to typically a 2-year period of time that is not an extension of your degree program. You will be graduated, you'll have your degree. However, a fellowship is a way to, in a very structured manner, learn even more about how healthcare is delivered and for you to find your passion within the industry. The MPH is structured in a very similar manner. It's also a 2-year, 60 credit program. It is also a competency-based curriculum, meaning that instead of looking at healthcare delivery competencies, we look at those competencies necessary for those who want to work in the policy advocacy space, policy development space, in government institutions, government agencies. So we make sure that you leave here with all of the competencies, the skills, the knowledge that you'll need to begin contributing in your field immediately. We focus in the MPH program on social determinants of health, dealing with health issues, broad public health issues related to socioeconomic status, of households in large communities and full populations, cultural beliefs and practices and how they impact people's interface with the public health system and with the healthcare delivery system. We look at behavioral risk factors, environment, gun violence, domestic violence. These are all components of our MPH program. The rest is really the same as what I just went over for the residential MHSA program. All MPH students also do a 10 to 12-week residency, plenty of clubs and opportunities. We have a club just for, or mostly for, MPH students, and then we have a club that's mostly for MHSA students, but we have a lot of overlap, people who are members of both clubs, not to mention other clubs that are of special interest. So there are plenty of clubs and activities, again, if you're an MPH student. Same thing as MHSA students, plenty of professional organizations. The American Public Health Association is one of those organizations that a lot of students decide to join. They run a number of different educational programs, an annual conference every year, just as American College of Healthcare Executives does. And there are local clubs and professional organizations as well that you can join. You also have the opportunity as MPH students to participate in case competitions. In fact, we participate in a case competition that is really global health focused and not really designed for health administration students. It is designed for those interested in global public health. And then, just as any other student, you can also pursue fellowships beyond graduation, and we have a robust career services program here in the School of Public Health that can help you either in your fellowship search or in your job search as you look to leave the university and enter the job world. The alumni network is extremely strong for both programs, so you will not be wanting for access to alumni who are out there. So why should you want to come to health management and policy and Michigan in general? Well, by the numbers, there's no place like Michigan. We are the number 3 public university in the United States, and we are ranked number 20 overall in the United States for national universities, including private universities. We are the number 1 public school of public health in the country. We are tied with the University of North Carolina at Chapel Hill. I'm sure many of you are considering applying there as well. It's a fine institution. The two of us are tied as the 2 number 1 public schools of public health. I have many colleagues there, and we are very proud to be the 2 top public programs. But overall, we are the number 2 ranked school of public health in the United States, period. And so you are not just getting the number 1 public school of public health, you would be coming to the number 2 ranked school of public health in the United States. We have a very low student to faculty ratio of only 8-to-1. As big as we are as a university with 50,000 students, as I mentioned earlier, we are a very small community of learners, scholars, and doers. And so we back that up in the classroom. You will have very small classes, particularly your upper electives, very small classes, a lot of contact with faculty. Faculty are available to you outside the classroom. They have regular office hours and are very willing to set up meetings with you one-on-one outside, even outside of office hours. We have over 65 health management and policy courses available to you. not to mention a host of classes that you can take in other schools or in other departments within the School of Public Health, as well as in other schools in the university, including the Ford School of Public Policy and the Ross School of Business. We have 26 dedicated full-time faculty members that you can rely on, in addition to 79 joint, adjunct, and emeritus faculty members. So we are a very robust community of faculty members who are here for one purpose, and that's your success. Big difference with Michigan that separates us from a lot of other programs is that we solve the big, hairy, audacious problems of the world. If there is a major initiative, a global pandemic, as we just lived through not too long ago, Michigan is at the center of that battle. We are the ones who are leading the charge, who are doing the research, who are delivering the care, who are managing the delivery of care, and who are setting new policy. We are in every branch of government. We are in every corner of the United States and every corner of the world with respect to healthcare delivery and public policy. The alumni network is unparalleled. I've been at a number of higher education institutions. You will not find a more engaged and robust alumni network anywhere in the world. The University of Michigan flag has been flown more than once at the top of the world, at the top of Mount Everest, and it is, and the Michigan Maze M is known worldwide. And so you will have access to that incredible network of alumni. They all want you to be successful, and they will help you to get there. We're the ones that develop the leaders who are going to shape the world. If what you want is to sit in a cubicle somewhere for the next 30 or 40 years, probably not the place for you. We want you to be the ones who go out there and set the strategic direction for public health and the healthcare delivery industry and solve those big problems and change the healthcare system to make it better. My generation, I was a healthcare executive for nearly 40 years. We had our chance. We made some positive change, but there's a lot of work still left to be done. And we want you as prospective students to go out there and be the ones to make the next big changes in the healthcare industry and in the public health world. We walk the walk. We don't just talk a good game. We are out there. We are practice oriented. We want to be in the trenches. We want to be the ones to bring about that change. And we focus on community and population health. Even healthcare executives who lead this program are focused on their communities that they're serving in their hospitals or health systems. They are focused on the populations that they serve. Those could be global populations, they could be small rural populations, but you are focused on those populations and not just improving care, but making people healthier who live in and around the community that your hospital or your health system is in. For those working in public health, you're focused on broad populations, maybe entire national populations, and of course, global populations. We work toward real world impact. We don't just do research for the sake of research here. Our research has purpose, it has application. And you will see many faculty members, if you do some research, and I know some of you have already done your research, you will see that our faculty members and our students are out there doing real world work. They're parts of policy institutes. They're parts of practice institutes and practice associations. They're already making big changes in the world as students, and our faculty are there to back them up and mentor them along the way. We really are everywhere that people need us. Locally, globally, nationally, we are there, and you can become a part of that community. There are plenty of opportunities for you as prospective students. I already mentioned the summer internship. You will also do a capstone experience, an integrated learning experience that will work. You'll work on a team to solve a real world problem. And so that is a transformative experience. And it's one that people always talk about. I hear alumni talk all the time about their capstone experience and who their client was and what they did for their client. And it's very satisfying to see the work that you do result in tangible change and results for your capstone client. I already mentioned case competitions. They take place around the United States. It's a great opportunity to get out, network, showcase your own talents, your own knowledge, and help Michigan to remain at the very top of the national list of programs. Networking opportunities, they're just, I can't even, we could spend the next 5 hours talking about all the different networking opportunities you'll have. Leadership development is part of what we do. It's embedded in our curriculum. We have a course on leadership development. We have an entire institute, the Griffith Leadership Center, that is focused solely on leadership development. And we serve the greater good. We serve the people who need us at their most vulnerable times of their lives. So our focus is outward in serving the greater community. And ultimately, what we want is for you to come in here and over the course of your time in the program, become your best self, find your purpose in life, find the direction you want to take, and develop all the skills, all of the knowledge, and the relationships, and build on your values to become your best self and go out into the world and do good in the world. Can't say enough great things about Ann Arbor. I'll do this very quickly for the sake of time. We have been ranked by Travel and Leisure as the best college town in the United States. I can attest to that. It's a great place to live. I live in Ann Arbor. Many of us do, or we live right near Ann Arbor. It is an incredible college town. What is really fascinating is that it is perennially ranked among the smartest cities in the United States. Now, having a major flagship university in the city of Ann Arbor makes it pretty easy to rank among the smartest cities in the world or in the country. But we have an incredible concentration of intelligence, and you will not be wanting for engagement in high-level intellectual conversation and very sophisticated people who you will be surrounded by every day. Really great downtown area, very bohemian for those of you who are into that. As you can see, I'm really bohemian, so I love that kind of environment. But it's a really cool downtown area. I mean, we've got 2 movie theaters that are both thriving a block away from each other. It's just an incredibly lively and vibrant downtown area. Great food for those of you who are foodies or really into food. As an Italian from New York, I have to say, I'm still searching for the perfect slice of pizza, but other than that, the food is phenomenal. Great music, arts, and entertainment locally. It's a very outdoorsy state, and so if you're into outdoor activities, sports, you want to learn how to row, there is a club in Ann Arbor where you can learn how to row. There's a place called Wolverine Pickleball where you can play pickleball and also learn how to curl and and be on a curling team if you want to do things that are fun like that. And then there's nothing like Michigan athletics. It's a religion here. If you haven't been to the University of Michigan football game at what is called the Big House, our main stadium that holds a very intimate 107,500 participants, then you haven't been at a football game yet. There's nothing like that experience. Even if you're not a football fan, it's the experience that's worth it. So how do you apply to the program? So you're going to do it, if you haven't already, set up your account with the Schools of Public Health Application Service, or as we call it, SOFAS. That is how you will apply to our programs. You can apply to both programs if you want to do a dual degree, or if you're not sure, you can apply to both the MPH in Health Management and Policy and the MHSA in Health Management in the Department of Health Management and Policy. You have to have all of the following for your application to be verified. Verification is really important because we don't get your application until it's verified. So please make sure your application is complete so that it gets verified quickly and we get it and we can review it. You need to have your official transcripts. You need your statement of purpose and objectives. You need to also write a reflective essay. This is a great opportunity to talk about something that we can't learn about in the rest of your application. So I encourage you to, let us know about things that you feel are important for us to know about in your reflective essays. You're going to write an essay about your quantitative experiences. You do need to develop a certain set of quantitative skills while you're in the program. And we just want to get a sense of your readiness to take on the quantitative components of our curriculum. You'll need your resume or a CV, also known as a curriculum vitae. Most of you probably have a resume. You just need to submit your resume or your curriculum vitae along with your application. Your letters of recommendation, very important that those are part of your application. And then if necessary, you have to show evidence of your language proficiency skills, and that is done through the TOEFL assessment. And so make sure that that's there to have a complete application. Now, I can't stress this enough, and this is going to wrap things up for us before we open it up for questions and answers. But our priority deadline is December 1st. Now, that means a lot. You will be considered. We do not guarantee that you will get a scholarship, but if you submit your application by December 1st, you will at least be considered for a scholarship. Beyond December 1st, we cannot guarantee that you will be considered for scholarship money. We have a limited number of scholarship dollars available to us, and you have to get your application in by December 1st for consideration. Charlita and I work on that together very closely, and I can't stress enough how important it is for you to get your application in by the December 1st deadline. You've got 6 weeks or thereabouts from now to get the application in by that time. And so I can't stress that any stronger than I am. Please get your application in by December 1st so you're considered. And that's all I have for you. What I'd like to do is open it up for questions and answers for Charlita and me, and let you take it over. Charlita, you may have some Q&A in the chat already, and so I'll let you start with anything that may be in the chat.
I was just looking at the questions, and we did have a couple questions about opportunities while you're a student to work with community or city health, community health and city organizations as a part of the student experience. And so do you have any insights with that? I know we have some internships and interns, and then there's some volunteer opportunities, but if you had any info to add.
Yeah, and I do. And so a lot of people find part-time jobs. Charlita will tell you, and I'll tell you, everybody here at Michigan will tell you, please do not get a full-time job. You will not be able to manage being a student in a full-time residential program with a full-time job. However, a lot of our students do get part-time jobs. We have Michigan Medicine, which is a major academic medical center and health system right across the street from the School of Public Health. And there are a lot of part-time positions at Michigan Medicine that you may qualify for and may be interested in taking on. Also within the local community, there are a lot of local businesses that hire University of Michigan students. And so that's another opportunity for you. Other hospitals, other health systems, public health agencies that may need volunteers or may have part-time positions for program assistants, positions like that. We also have, on occasion, opportunities within the school and within the department for people to work as graduate assistants for either coursework or on research projects. That is on an ad hoc basis. It's not like we have a pool of people who we hire as graduate assistants, but we do have people who can get hired from time to time. Is a part-time commitment, and you work usually on a project or potentially supporting a course. And so there are a number of different opportunities in both in the community, within the medical center and the health system, and then also outside of the university in health departments, public health agencies, and local charities like a food shelter, a food pantry or a homeless shelter, soup kitchens, places like that.
Thank you. The next question, what kinds of mentorship or advising support do students receive?
So your first mentor, well, you're going to get two mentors to start. You get your faculty mentor, who is your advisor. And we don't just randomly assign you to advisors. Charlita and I and really the entire team, we talk about fit and we talk about matching new students to an appropriate faculty advisor who can help that student as both a mentor and an advisor. It's a kind of a dual role. And so your faculty advisor is your first or one of your first mentors. Something really unique here is that this is something that the students actually operate, and that is the second year student mentorship program. The students themselves are mentors. And so second year students volunteer their time to take on a first year mentee, and they will tell you what it's like to be a student in the program. They'll tell you what to pay attention to, what not to pay attention to at the outset to help you manage your time and find balance. Charlita and I are going to tell you that you have to do these 10 things in the next month because we need you to do those 10 things. Your student mentor is probably going to say, don't listen to them, do these 5 things, and then you can do these other 5 things next month. And they'll guide you as to how you navigate the program the best way as a fellow student. So those are your first mentors. But then you will be starting to meet alumni mentors. And the alumni, as I mentioned earlier, they want to mentor you. They want to be there for you. They want to help you, not just develop your areas of interest, but also to mentor you in your future careers. And we have ways of connecting you with alumni who are aligned with your personal interests. So all you need to do is ask. Professor Kalali is one of those people. She's very connected to the alumni network. It's part of her role. And so she is a wonderful resource to connect you to our alumni. So you will not be wanting for mentors. You will have plenty of mentors, not just at the start of when you come here, but by the time you leave here, you will have built up a huge network of mentors.
Thank you. So there are a lot of questions in here about the priority deadline. So I'll just clarify. Submission on SOFAs needs to happen by December 1st. Okay, if you submit on December 1st, you're still considered priority. However, it will still take 3 to 6 weeks for verification. So we would get your application in January if you submit on December 1st, or late January or later. If you submit today and we start reviewing applications next month, you would hear from us sooner because your application will be verified sooner. Okay, so that's how the priority deadline works. And verification notification will come from SOFIS directly to let you know that your application has been verified. And then we had a question about the course requirements in health policy and the MPH, talking about them more in detail. And I think one of the parts is the 12 credits of SPH core requirements that all MPH students do in the first year. That core covers all of the public health departments in different ways. And Dr. Canalato can talk about that a little bit more.
Yeah, and so it's as Charlita mentioned, it is a 12 credit sequence. It's 2 semesters, and you take courses taught by core faculty members across the entire School of Public Health. So you learn topics related to epidemiology, health behavior and health equity, nutrition sciences, obviously health management and policy. You learn from all the disciplines within the School of Public Health so that you have a core knowledge base that you can build from when you take your specialized courses in the department or in other schools or other departments within the School of Public Health. But that 12 credit sequence, it's 6 credits per semester for your first fall semester, and then we operate with a winter term, not a spring term. It's essentially the same calendar as other schools' spring terms. We just call it a winter term. We also do have a spring term, but it starts later in the year. And so you would take 6 credits of that Public Health 500 class in the fall, and then you would take your other 6 credits in the winter term of your first year. And again, that builds your foundation of knowledge on all things related to public health so that you know about epidemiology, you understand about nutrition, you understand what health behavior and health equity is about, and how community education is organized. So we want you to understand the totality of public health as an MPH student so that when you are specializing in your coursework, looking at building your expertise in health policy and management or health management and policy, we have you have that foundation to build from.
Thank you. We have a question about how accessible are faculty for mentorship or research collaboration?
Great question. So the faculty are extremely accessible. We all have office hours. We're all available to you. And I think I mentioned earlier, but just to reiterate, if you're in class during someone's office hours, you send them an email and ask if you can meet outside of office hours. Every faculty member is willing to do that. So we are very, very accessible. If you need to speak with someone, you just reach out and we will make the time to speak with you. And that isn't just the full-time faculty. Our adjunct faculty are just as committed. So if you need to speak with an adjunct faculty member, just reach out to them by email and you will be able to contact them. And it may be a Zoom meeting if they're adjunct and they're not on campus, but you will at least be able to connect with them. A number of faculty members do have research projects that students work on. It's on an ad hoc basis. It's not that we have a set of positions available, but faculty members do very often work with students on research projects. And so you do have access to faculty research, and to the degree that you may want to embark on your own research study, faculty members are very willing to mentor you in developing your own research questions and your own research study design. So we're very available. We encourage student research. We engage you to the degree that we can and have those opportunities. And we love to see people follow their hearts and research the things that they're coming here to learn about.
Thank you. And we also have a number of students who have done the master's program and gone into our doctoral program. So those students are available if you have questions about that process as well. It's not, half the class of maybe 2 or 3 students, but that is another path. And those students are available to you for questions. And then there was a question about, is there a work requirement for the MPH or MHSA? Some programs require applicants to have a minimum of 2 years post-undergrad work.
So we take it on a case-by-case basis. We like to see some work experience. However, we do not require work experience. And so you can apply directly out of your undergraduate program and enter the program. If you have work experience, all the better. And the one thing that we ask of you, if you do have that practical work experience, is to bring your experiences into the classroom and share those experiences with your classmates and with your teachers so that it enhances the classroom experience for everyone. But we don't have a hard requirement. You don't have to have been working for a certain number of years. Again, you can enter the program directly out of your undergraduate degree.
And that leads to the next question. Where are the majority of students employed after graduating, and what is the postgraduate employment rate?
So our postgraduate employment rate officially is 98%, I believe the last number was, Charlita. However, that is measured in a very short period of time. In general, we have reached 100% employment within 6 months of graduation. We can't officially report 100% employment rate, nor can we promise that, but suffice it to say that our graduates get jobs or fellowships, whatever they want to do. A lot of people go to, and I'll share this screen with you just to give you an idea of where people are going. But I have a slide here for you. So a lot of people, are entering hospitals and health systems. It's where a lot of internships are done. A good number are entering the consulting world these days. In fact, that number has been going up quite significantly. It's been an almost exponential rise that a lot of people are entering the consulting world. You can see it's about 25% of our total graduate population going into consulting. A number are going directly into information technology and analyst positions. about 4% into government agencies. Very interestingly, a number of people have been entering the VC, the venture capital, the private equity, and the trade association world, and that number has jumped by more than 100% in the last couple of years. Some people go to the dark side, they go into pharma and biotech. So you go for the money, and that's great. If that's your passion, that's what you want to do. It is, all joking aside, it's a very rewarding career path to follow. And so I often do encourage that. Number of people go into physician practice management. A lot of And so there are a lot of careers in practice management. Some people who are in the program are physicians, and they're either already physicians or they're medical students who are doing a dual degree. And so they get counted in people who go into physician practice as well. Number go into volunteer foundations, private agencies, think tanks, places like that. Rising number of people going into the insurance, the health insurance, HMO industry. I spent 10 years as a healthcare insurance executive, also a very rewarding career path for you. And so this is a snapshot of, where the majority of people are going, but people go into any one of a number of different industries, all healthcare related. And this is not counting the people who are doing fellowships. And so if you were to put in the people who are doing fellowships primarily in hospitals and health systems, you would see, a higher percentage going into hospitals and health systems. And I'll take that share down.
We also have a question about the MISA. So can you give an example of activities that MISA, Michigan Healthcare Executive Student Association Club hosts, their site visit, community work, etc.?
So great question too. A lot of community service work and opportunities to connect with community organizations. MISA and HIPSA, which are our two bigger organizations. MISA mostly MHSA students, HIPSA mostly MPH students, get involved in running a number of networking events. They're very focused on career development. They bring in speakers to speak to the students. These become events for the entire department. Faculty attend as well. They run, as I mentioned, networking events. The school overall runs a number of career development and events, as well as a career expo. And so you have plenty of opportunity to connect with employers in the real world who directly recruit from the University of Michigan, from the School of Public Health. And so, and then all of the other student organizations run social events, they run fund drives, fundraising activities. We have a really fun silent auction that the MISA group runs each year, and that always gets very robust bidding during that event. So we just have a host of activities, networking, professional development, community engagement opportunities for you as members of the community.
Thank you. The next question is, are courses designed to be catered to student-specific interests? For example, choosing different topics for papers and projects based on career trajectory.
Another great question. So to the degree possible, there has to be a little bit of consistency so that we are teaching you your competencies. But as you'll see, the professors, when we assign either group or individual assignments, we give you some degrees of freedom to choose the topics that you want to choose. So I'll give you an example. I teach a really exciting course called Managerial Accounting. I know that you can't wait to take that class. It is jam-packed with exciting activities. But in that class, we do a number of case studies. And when we do case study work, I will let you pick the organization that you want to do the case study on. And so we have one exercise where you look up an organization in a public database and do some analysis about that organization, about their financial health. And when you do that analysis, you can pick any organization of your choosing. It could be a public health agency, it could be a hospital, a health system, it could be a government agency that you can do research on. And you can explore your interests. You can write papers very often on a topic of interest. I have another class I teach where you develop a strategic plan. And you can develop that strategic plan for any organization of your choosing. You could even start your own new organization in an area that you might be interested in being entrepreneurial in and starting your own organization. And so the class is an opportunity to actually build a strategic plan for a new organization that you might want to start up. And so you have plenty of opportunity, not just with me, but with all the faculty members to explore your personal interests. You will need to focus on the deliverables that are universal within a class, but again, to the degree that we can, we make this as personalized an education as possible.
Are there any other questions? I think I covered all the questions that were in the chat.
All right, so with no other questions, you can reach out to Charlita, and I see you, don't worry. So you can always reach out to Charlita or me with any follow-up questions that you may have or questions that you think of after we're done here today. But please reach out. We are both, our contact information is on the website. And you will get this, right, Charlita? They will get a recording of this.
Yes.
And so we'll include our contact information in that email as well. But don't hesitate to email us. We are here to help answer your questions and give you guidance along the way. And with that said, Rachel, or Rochelle, you have a question.
Hello, yes, Rachel. Thank you. This is really helpful. Sorry, I had kind of a bit of a detailed question, so I thought it'd be easier than writing in the chat. I'm planning on applying to the dual degree program with genetic counseling, and the health administration program. And I was wondering if in my statement I could also mention my interest in genetic counseling and how that blends with my interest in healthcare administration, or if I should just focus on the healthcare administration part.
No, we would love to read about that because, first we're going to know that you're applying to both. And so we're going to want to see how your health administration degree, how your MHSA fits into your broader statement of purpose and objectives. So how will this degree, this dual degree, get you where you want to get in your career? And so I think I would love to read an essay like that melds your interests in genetic counseling with your interest in healthcare leadership.
Great, thank you.
Remember, in your statement of purpose and objectives, be very forthcoming. Tell us what your dreams are. What do you see yourself doing in the future? Where do you want to be in a few years? How are you going to use your Michigan education to reach your goals? We want to be sure that you can reach your goals if you come here. And the only way for us to know that is if we hear that directly from you. So please be very transparent in writing that statement. It's meant for us to be sure that you can reach your objectives. Are there any other questions? All right. Well, thank you all for coming. It was a real pleasure to meet you all. Thank you for your questions. Please give a big thanks to Charlita Daniels. She puts this all together. All I have to do is show up and talk and be my usual charming self, which I know you all appreciated during the session. But Charlita is the architect of all of this. So thank you to Charlita, and thank you all for being here.
Thank you.
Thank you.